with the new year comes new health goals, and today Healthy Communities in Delaware is holding a symposium where local nonprofit organizations, for-profit organizations, and local government entities are joining forces to learn new opportunities on how they can make our communities a little healthier.
Healthy Communities Delaware is aiming to increase the amount of attention and investment in what we call the social determinants of health, and that's working with a variety of people at the local and county level, to address issues like housing and access to food and safe neighborhoods and decent housing, because the research has told us that many of the determinants of health are not just clinical health care, but they are these other factors that we really do have to address. So the Healthy Communities Delaware is a statewide effort to essentially support and enhance and encourage local communities to plan for their future and to address these social determinants of health, which will have the ultimate impact of creating a healthier community and a healthier population.
As our nation struggles with what is fair and just and for whom, the urgent call for health equity rings loudly in Delaware.
I'm very concerned that Delaware is 31st in the nation for health outcomes, but I'm also extremely concerned about the health disparities that we see. Certain populations don't have as healthier outcomes as others, and we can actually, we look at zip codes across the state, we see differences in health outcomes based on where people live. Now, often people think about the healthcare sector as being the answer to improving health, but we've learned so much more over the past few decades to better understand that things like housing and community development, community design, access to healthy foods, access to recreation, access to good jobs and education, those are factors that are so critically important to health.
Health equity means a fair and equal opportunity to achieve the long and healthy life we all aspire to live. But for some of us, there are hurdles too high to jump.
I think it is unacceptable that an adult in a low-income community in Delaware is much more likely to suffer from diabetes or certain cancers than their fellow Delawarean and neighbor just a mile away, but in a different zip code and in a different context. It is, to me, unacceptable that African Americans are more likely to die prematurely than their white neighbors. Unacceptable that Hispanic children are more than 3 times more likely in our state to live in poverty, a factor directly related to poor health outcomes. And unacceptable that black children in our state die at a rate more than twice that of white children in infancy. We haven't yet created the system that addresses, identifies, and tackles the ways in which historic injustice continue to be propagated generation after generation and has consequences for health care and for health outcomes.
With discussions on healthy communities on the rise throughout our country, Delaware has seen some progress and gains on addressing the determinants of health within our communities.
HCD supported better efforts by the Delaware Coalition Against Domestic Violence to better integrate healthcare and domestic violence services in collaboration with Westside Family Health and Christiana Care to provide trauma-informed training on screening for domestic violence. Health workers can then connect survivors to domestic violence community health workers who can provide care, address safety, do a risk assessment, and proactively ensure access and follow-up. This is a critical lifeline. This is an obvious and common sense, perhaps, but long overdue way to integrate different channels of care. I've got 4 more examples I could read, but my hunch is you probably already all know every one of these examples that I'm citing. So let me simply say this. I am inspired by who you are and that you are together. As I came in, I was talking to Lottie Lee Davis, Pastor Lottie Lee Davis, who's affiliated with Be Ready, Jesus is Coming Church. And I've known her and seen her for decades. And what she's able to do is another example of the kind of interventions that I think make a difference that are large or small. There was a park just across the street in Hilltop that was gradually being overrun from a safe playground into a dilapidated park, a place that was frequented by drug dealers and was used for all sorts of, let's just say, illicit activities. And she and other members of her church decided enough was enough and adopted the park and pushed back out those who were taking advantage of it all hours of the day and night for illegal purposes, and pushed back on a city proposal to fence it and close it off from access to the community and to children, and instead said, this is our neighborhood, this is our park, we're going to take responsibility for it and bring it back to life. The park was completed in 2017, reopened, and has seen a huge increase in the number of neighborhood kids and families able to recreate there. Now, why does this matter? It matters on 3 different levels. 1, because kids need a safe place to play. 2, because neighborhoods need to be able to demonstrate. We need to be able to demonstrate that we can come together and do things that folks don't think we can do. And 3rd, we, all of us, need to see a pathway from our current disappointing or depressing or maddening reality to a brighter and better future, and then share those stories of risk and of work and of progress together.
Collaboration was a key part of the symposium as it brought partners from diverse sectors together to ensure that good health is happening throughout the state.
When you're working to improve the built environment, housing is very important, but you have to think about access to quality health care, access to healthy foods, access to quality education. So really looking at it from a comprehensive perspective is very critical. And so I appreciate the opportunity to be at a symposium like this because it talks about that comprehensive approach and how all of these organizations are interconnected, and that we have to really be strategic about integrating our systems, integrating our goals and objectives to really achieve a deeper, long-lasting impact that we're all working towards.
We can't do any of the work that we're doing, especially focusing on social determinants of health alone. We have to have those partners in place that we can build off of each other's strengths, we can communicate together and identify the areas of opportunity and needs in our communities. So the more partners that we have, the better off we'll be and the better we can accomplish our goals at the end of the day.
We all know that our health is largely shaped outside of the doctor's office. Where we live, work, play, and pray also has a great impact on our overall health and well-being. Today's symposium addressed all those angles and how we can live a healthier lifestyle here in Delaware. Reporting in Wilmington, Delaware, Yesenia Taveras, WITN 22.